All this is Dr. Mobeen Sayed. Welcome to one more show. Today with me is Shaun Barcavage. He's a good friend of mine. He is a researcher. And just very quick introduction to his bio. He's a 51-year-old research nurse practitioner from New York. Prior to joining the medical profession, he had a background in international development, having served in various capacities over 12 years throughout Eastern Europe and during Balkan War with the Organization for Security Cooperation in Europe. I would request Shaun to tell us more about him. The thing that we want to discuss today, the topic that we have today, is the post-vaccine injury and what are the possible journey that many people are going through. What is the help to seek? What help has been valuable for Shaun? What are areas which ended up as dead ends for his help? At the end of the day, this discussion, and my request to you is that please respect his privacy. Don't ask too many invasive medical questions about his health. He has graciously agreed to be with us so that more people can be aware of the injuries. I think he is a pro-vaxxer. I am a pro-vaxxer. So it's not about vaccines are good or bad, but drugs, medicines have side effects. What are the possible side effects? How to pursue a solution for them. So I don't want to continue too much. I want to welcome Shaun. Thank you very much for being here. Tell us a little bit about yourself and your journey.
Sure. Thank you, Dr. Bean, for having me. First, I'd just like to clarify that I'm here as a private citizen. I'm speaking personally about my own personal story and experience with the vaccination. I'm not speaking on behalf of any organization or institution. I also want to clarify that I am very pro-science and very pro-vaccine. So the intent today is not to deter anyone from vaccination. It's just to speak about my experience. And as a researcher, I want everybody to know that, reactions are real. They're a natural part of science. They're not something we should avoid or deny or dismiss. I think we should encompass them into the body of scientific research so that they're studied and understood. I don't know if you want me to talk a little bit about what happened to me with each vaccination.
Absolutely. So, one, I am interested if the audience can hear about your day-to-day work. What is the kind of work that you do, and totally as much as you want to share. And then, what is your experience with the vaccine?
Right. So my work as a researcher, I have a background as a nurse. So I worked in various capacities as a nurse in hospitals on different floors, working in different medical areas such as telemetry, pediatrics. So I have a good broad base of foundation in nursing itself and doing the actual job of nursing. Later, I moved to become a nurse practitioner, and one of my passions has always been community health and infectious diseases. So as soon as I graduated, I gravitated to community health and started to work in HIV primary care. And then as I progressed in my career, I moved into research and clinical trials on various drugs related to HIV and hepatitis C. And then later through the pandemic, helped work on several therapeutics for COVID.
Got it. Thank you very much. And for the cool beans, when you see me looking down here, this is the monitor here. I'm looking at your comments here. I'm looking at Shaun here. This is the camera. So please don't be offended when I'm looking away. I want to make sure that the environment is very respectable for Shaun. So Shaun, please don't mind when I'm looking around. Okay. So with this, Shaun, tell me, when did you get your first dose? Was it a 2-dose vaccine? What happened?
It was a 2-dose mRNA platform, and my first dose was quite early because I'm in the medical profession, so I was in the front runners of people receiving vaccination. So my first dose was late December 2020, and I remember going there with like excitement to get vaccinated, get protection, reduce some of that fear and anxiety around COVID. And I had the first injection in my right deltoid. And I noticed almost immediately, not like around 15 minutes after into the injection, some strange sensations up and down my right arm. And I remember making a comment to the nurse. I said, "Oh, something feels a little strange." She's like, "Why don't we have you sit around a little longer, make sure everything is okay?" Uh, it was kind of like a cool, warm sensation up and down my arm. I thought, "Oh, okay, maybe it's just nothing." I felt fine. I didn't have any severe type, anaphylactic type reaction. It was mild. So I came home. Sensations were still there. I woke up the next day. I still had more sensations up and down my arm. It started to gravitate into my axilla area and my up scapular area. And then I remember probably day 3 or 4, I started to get eye irritation in my right eye and a little bit of cheek tingle. Very minimal, but the eye irritation was really strange. And I thought I had like something stuck in my eye. And I didn't immediately associate it with the vaccine because it seemed so unusual. It's not like something you would think of as a typical reaction. So I remember seeking to consults with eye doctors because I kept insisting there was something wrong with my eye. They said, no. They stained it. Everything looked good. There was nothing in there, no infection. Then I think by day 6, I had a flushed ear, bright red. And that lasted about 3 days and then disappeared. I consulted with a neurologist because the paresthesias, the numbness, tingling stuff was still kind of going on. And I had this almost like a sensation like I was sweating in my armpit. But every time I would go to touch there, it was dry. They did an EMG. It was normal. Everything after around day 10, 11 just subsided. And I felt good. So, we didn't know much. We didn't understand much at that time. They were just, rolling out. So I thought, well, I should get the second dose. I had the second dose in mid-January or towards late January. And initially I had 3 days of just typical, I had it in the left deltoid this time. And I remember I had 3 days of just general, your usual injection site pain. But the pain kind of radiated up my neck and into my back. It was pretty significant pain, but I thought, oh, it's just from the injection. It'll go away. By day 4, I started to hear faint chimes sounds in my right ear. And the tingling returned. Some of the right eye irritation returned. So even though I got the injection on the left, the flare of things started on the right again.
So, Shaun, I have a question here. My apologies for the introduction. Did you have any previous medical history, for example?
Yes, no, I should. So I'm a 51-year-old healthy male. I had no medical history significant. I have no chronic medical conditions, no autoimmune diseases. I've never had a vaccine reaction before. I've taken every vaccine known, all my boosters, no reactions. No history of hearing problems or tinnitus or neuropathy, no diabetes, nothing. I was not on any medications or supplements at the time. I don't drink and I don't smoke. And I don't do any other of the other substances. Yes. So fairly healthy and,
so
normal.
What's happening in these first days, weeks? Was there anyone, medical doctor, your own doctors, or folks who may be around you, was there anyone who was able to provide any help, any guidance? How was your...
No, I think so. The first, I after the second dose, I reconsulted with neurology, and they were like, well, if it subsided last time, maybe it will subside this time. And unfortunately, that wasn't the case. And again, one of the problems is that these are relatively new. So I think the medical community we don't have the experience with them, right? So it's not like a measles, mumps, rubella shot we've been giving for 20 years. We know all of the ranges of reactions that have, in the years they've been given. So there were a lot of unknowns. So I think you can't blame anyone for not knowing, right, when something is new, and we're all just doing our best with what we know. And I think that was kind of the issue in the beginning, and the people who received vaccinations early on, you faced a medical community that was just kind of discovering how these are playing out in the larger populace.
Got it. So with the second dose, now you have more symptoms. Doctor said maybe just like the first one, these would go away.
Yeah.
What happened? Did they continue aggravate?
So they continued. The tinnitus kind of started to escalate to a severity that was profound. I'm talking like a 10 out of 10, where you're, literally on the bathroom floor and you're crying because you cannot believe what has happened to you. And you thought, this is not something you could live with. I'll be quite honest. It was pretty profound. So that set me on a desperate search as a nurse. Like I'm trained. I want answers right away. I want to know what's wrong. What should I do? So I did a lot of consults. I think I consulted with 4 ENTs, and at that time, a lot of them were like, could this be or could it not be? Is it coincidence? And I'm like, as a researcher, I'm 1000% sure this is not coincidence. Like, the timing was just, too perfect. My medical history was not, non-existent. And so, temporally, it was just, you could not deny the association in my mind. And given all the other thing that really sealed it was that, the second dose in the other arm spiked paresthesias that I experienced on the first dose in the right arm. So to, deny causality there, it's a little tricky. And my opinion.
So the second dose was in the other arm, and the other arm experienced the same.
No, so the first dose was in the right, where I had the paresthesia. Second dose in the left, but flared the paresthesias initially on the right, and the tinnitus on the right.
Wow, so very interesting.
So seems like something was primed somewhere, and then the second dose, let it loose. So again, my suspicion, of what, I can't say what happened on a cellular level. We just don't know. I wish we did, but we're not there yet.
So then, trying to solve this, did you start taking some medicine, some protocols?
So my initial instinct was steroids. They're always the go-to when you want to tamp down some kind of immune or inflammatory response. But a lot of people were reluctant to use them because they were afraid it would also alter your immune response.
Right. Correct.
So I was kind of delayed in that, and I look back in hindsight, and I think there is some good research data now that shows in this kind of vaccine-induced tinnitus, or I should say suspected, for nothing is proven, but there is some research that shows that some people who've had vaccine-induced tinnitus respond well if treated early with a higher dose of steroid. And, I didn't go that route, unfortunately, at that time.
So does your neurologist then think that it still is an inflammatory situation? Or, I mean, steroids should still help if there is inflammation. normally their help starts reducing when either it is not an inflammation related thing, or some injury is becoming more permanent, and then giving steroid cannot reverse that injury. What
Correct.
is, there may be other reasons. What did your neurologist say? What is the current situation?
So the neurologist I'm seeing now, well, let me just step back if I could and just clarify what happened further. So
Please.
by the end of January, the symptomatology became so severe that I developed like wild swings in blood pressure and tachycardia and abdominal pain. And I actually ended up in the emergency department in Pennsylvania, where my family is living. And I even said to the ER doc, I'm like, look, I'm a nurse practitioner. I work in research. I suspect I'm having a reaction. I was having the tinnitus really bad, the tachycardia, my blood pressure was like 180 over 120. I had a bad headache, stomach pain. He was suspicious of it. He's like, we haven't seen this type of reaction before. They ran me through a CAT scan, found some mesenteric inflammation, said, oh, you probably have a viral syndrome, and sent me home with ibuprofen. I was not happy, but that's what happened at that time. And obviously the ibuprofen did nothing for me.
So, you yourself are a researcher. You have been interacting with doctors, trying to figure out what it is. It is pretty serious. So, it is not that you are just ignoring it.
No.
What did you think of the preparation of the medical field, the preparation of the vaccine related injuries, and
Mhm.
approach to them in general? Were you actually finding people who had any direction, or everyone was just trying to figure it
I
out?
think everyone was kind of fumbling around. And I think that was just the nature of being in the middle of a pandemic, right? We have to be realistic. We're in a crisis. We're trying to end that crisis. We're rolling out what we think is an important tool to end that crisis. And I think there's, you probably can never get it right, but I think what was missing was some education, or at least a support system in place where at least ER doctors could call in to some kind of center, either with the manufacturers or with, a government body, and consult on what they're seeing, right? I think that wasn't and still isn't in place really. So people are still fumbling with like how to deal with reactions.
And on this point, I actually made a comment a few days ago. There was a Cool Beans question, and I was saying, in theory, vaccine companies, all of them, and FDA, CDC, are healthcare leadership organizations. They should have come together and said, here is a pool, here is a
Hmm.
fund. I mean, there is a lot of money going into vaccines and their purchases and their building. And
Right,
we are paying, the taxpayers are paying eventually.
right,
So if a pool can be made, and from that pool, studies and help and educational material and consultations could be given, I think there
right.
is an important need for that instead of individuals trying to figure it out on their own.
I
What do you?
I would I agree. I think that would have been prudent and a wise, especially when you're rolling out something, a new platform for a vaccine, and there are a lot of unknowns in the general population. What we knew was from the clinic. What we know is from the clinical trials, right? But that when you put something out in the general population, like with any drug, anything can happen, right? And the goal is not to deter people or to make people fearful. I mean, somebody could take Tylenol and get a reaction, or aspirin and get a reaction, right? These are all things have reactions, but I think you to deny them or not address them is you know not scientific. You're just it's not realistic to say everything is 100% either
Agree.
way,
And
right? And then you leave a pool of people that are unlucky like myself, and may not be large numbers, but we exist, and to not help us is a disservice. I think a grave disservice, because I still struggle to understand what happened, and what course of treatment I should be seeking.
Absolutely correct. And I think this is another tragedy of this pandemic, that there was a good thing, and that is that we all jumped in, medical professionals or not medical professionals. We all jumped in to try to figure out what is happening, what is the virus, how do we fix it, what are vaccines, what
Hmm.
are other drugs. And one of the outcome of that is that there are folks who are not who are not medical professionals or medically
Right.
educated, and they are trying to help as well. And what I'm seeing is that sometimes intents may be good, sometimes
Hmm.
that direction becomes bad. For example, I'll give you my example. Um, from last year, when I started talking about vaccines and said when the vaccines would come in and go take a vaccine, and then when the vaccine started and the clotting started occurring and the pericarditis started occurring, I started talking about clotting. And the very first reaction from the audience members was, some of the audience members was, shut
Hmm.
up, don't talk about it, what are you doing? And
Right.
I thought that that platform where we could look at everything together, because the whole
Right.
world is stuck in it, is
Hmm.
important, so we can see what is the good, what is the bad, and how do we take care of it. But
Right.
I digress. I'm still going through these
Right.
kind of reactions. I
Right.
digress.
Well, the scientific world should remain in the hands of scientists, right? And we should not fear, the data, good,
Absolutely
bad, or indifferent. It's
correct. And that is what
science.
helps us drive. So I
Yeah.
think that I still believe, I have been protesting this for a long time, that we should become aware of what are the side effects, then we should
Right.
try to figure out what we can control. After that, we may say, here is a vaccine, or here is another drug, molnupiravir is out, or some other drug is out, and
Hmm.
they may have side
Right.
effects. We should say, here is a drug,
Right.
here are the possible side effects. Here are the things that are under our control. Here are the things that we cannot control them. Here is a cohort that should not take them. Here is a cohort that should take them. We should have such keen observation and data collection and analysis being done every day. Anyways, that's not
Correct.
happening. My
Yeah.
question to you then.
Mhm.
So you tried steroids. What other things have you tried? Anti-inflammatories? You tried ibuprofen, didn't work. Did you try
Um,
statins?
right.
What other
So
things?
eventually, early on, I did do like one ENT did say, well, try a Medrol dose pack, but I was probably already past the fourth week part. And, that's a Medrol dose pack is not a very strong steroid, but I did do that. And it did tamp down the inflammation in my abdomen, and got that under control. Later, I did just my own search, just because I couldn't find the medical practitioner, because they don't exist, experienced in vaccine reactions. They're not on every street corner. But being fortunate, being in medicine, I tried to direct my own research and my own care for all of its successes and failures I've had over the past 11 months. But I started to set up groups online, because I thought, oh, at that time I thought it was just me, and I wanted to find other people to see if more to find support and validation, to see if I'm not alone, that I'm just an oddity. And so I set up a tinnitus support group, uh, online, and we have over 3,000 members now. And we do a lot of support and research activities in there, which is very important, because tinnitus can be a very debilitating uh, illness for people. So support is everything. So through there, we share what we try, what works, doesn't work for different things, different theories. I went on different diets. I tried like low histamine, MCAS type diets. which I thought actually was helping my tinnitus in the early stages. So, but then it didn't really continue, right? So I really thought, oh, mast cell, and I did. I see somebody's raising a question about mast cell, but I did do a lot of lab work. I probably had a multi-million-dollar lab work that I pushed for in my quest, and I did do a lot of MCAS workup. And in my case, even the more specific urine studies, they always came out normal. But I did find anecdotal evidence that a low histamine kind of MCAS diet was helping. But unfortunately, things progressed and I got beyond the tachycardia, which continued. That evolved into full blown autonomic dysfunction by March and April, where I had severe intractable insomnia. I had tachycardia episodes that would just come on and go for hours. Then it evolved to positional tachycardia. And I'm a straight bradycardic 50, 55 person my whole life. Now suddenly I'm sitting 55 standing going to 150, 160, feeling like I'm going to pass out. And I get nauseous. And and nothing was really working. I had, for the insomnia, I went on like several sleep medications, and I had never had problems with sleep before, but it was almost like my parasympathetic and sympathetic nervous systems would just not work. Like every time my body wanted to go into calm, it would just trigger me. And I would get like pour of adrenal dumps through my body that I could literally feel the chemical coursing through, burning my stomach and muscles. And this was by like June, July. So things kept going. And I kept seeing doctors and telling them, and cardiologists. And some people would be like, is this real? It's a lot of subjective stuff here. And, doctors generally don't deal well with subjective symptoms. They like the objective, right? And if your lab's coming back normal, you're reporting subjective things, they tend to want to throw you in the basket of like anxiety or functional neuro disorders or things. But I knew, and that wasn't my case. And so I had to push for objective. And I did. And so I got I did, the autonomic testing, which showed I had positional tachycardia. And I did, eventually things progressed in August, where I woke up one night with full blown neuropathies all over, generalized my body, stinging in my hands and feet, burning sensations all over. And, again, I went to the ED. I went to my doctors. They're like, we don't know. Let's check rheumatological. Let's check more autoimmune. Everything normal. I said, well, my neurologist by July was suspecting pseudomotor small fiber. She was the first one who was really engaged and curious. And she said, I think this is what's going on. What's causing it and driving it, we don't know. But I said, well, what's the definitive test for that? And she said, well, usually a skin biopsy. So I thought, oh, I have to do that. I need to know. So I arranged to have that done, and that did come back showing signs of small fiber neuropathy developing. So there I had some, by August, I had some objective data of like things that had gone wrong over the course and what was driving this autonomic dysfunction and now the new onset neuropathies that I'm dealing with.
So were they able to then start pinpointing that this is cytokine storms, or not storm, but continuous cytokine release from the cell?
So that we don't know, because like I have done cytokine panels. I had some elevations. I think nobody just really knows right now what is the primary driver. There's a lot of theories, right? I mean, I think some are known. We have our, these not the non-classical monocyte theories hanging out. There's some people who think it's, related to the T follicular helper cell and how that is used to create the immunity. There's some theories that it could be C4d deposition at the blood nerve barrier that was triggered, like the dysfunction was triggered. So we don't know. I've heard, MCAS components. I've heard glutamine storms. So there's a lot of unknowns.
I'm very sorry that you are going through this. My sincere gratitude that you're here, you're discussing it. And I wish this all becomes resolved soon. If it is, so far I've seen many long haulers that have been recovering even after a year or so. So prayers and good wishes and anything we can do, me and Cool Beans, you yourself are a Cool Bean. If we can all together do something, please.
Yeah, I think your audience is quite, you have a quite intellectual following. So one of my goals coming on here is, one is not to deter anyone from vaccination. That's not my goal. Two is to raise awareness that, reactions happen and those who have them need help. And I think three is to get your beans thinking caps on and help join our effort to kind of understand what's going on. Because we're desperate for answers and healing. And I feel like every day that goes by, I slip more towards the chronic. And I don't want that, because what I'm feeling, I may look healthy still, but I can assure you, when I sit here, my ears are hissing and my feet are burning and my nerve is taut. It's like damaged. So I have a lot going on and it's not fun.
I can understand this. Cool Beans, I was talking with Shaun before the discussion, the live discussion, and I was saying that because of my drawings and the work that I've been doing for last 18 months, I have some numbness here, but this arm a few weeks ago had developed severe pricking feelings, and that is the sign of nerve compression over here. And I was just too stressed out and I was leaning incorrectly and so on. And I cannot imagine that just that little thing in my fingers bothered me so much that I thought, what the heck? And here we have someone whole body.
Yeah. I get burn sensations down my chest. Feet feel sometimes like little electric toothbrushes on low vibration. Little prickling sensations everywhere, burning.
Very sorry for that.
I feel nerve dysfunction in my hands when I stretch them. And I don't know why. That's the puzzle. I'm working. I research myself all day long. I read all the journals. I try to connect dots, but I'm not an immunologist. So we need help. We need some researchers on board.
So in the community, if there are folks who have experience with this or who would like to contribute in research, please do that. Shaun, use me as a resource as well.
Yes. And I'm very transparent about my health and my data. So in the quest to help others, because I know I'm not alone. And I know there's a lot of people who don't have the fortunate opportunity to one, be in healthcare, and two, have insurance. So whatever I learn, I share with the intent of helping others out there that have the similar afflictions. So,
Got it. Thank you very much. This is very generous of you. I mean, just opening up your own situation and then hoping that others can be helped as well. So thank you. If you are okay, can I ask some questions here as well? I know it is 40 minutes. I know you are on the East Coast, so it is late on your side. Just another 5-10 minutes of questions, if that is okay.
Sure. I'm happy to help. It's important that raise awareness.
Thank you. Thank you. So there is a question. Ashley says, how do we treat microclots? So what is your experience? I mean, it may or may not be microclots,
Right.
but has there been any clotting related therapeutics as well tried or thought about?
So some of the that's a good question. I don't even know how you, unless you do biopsies, I think, how do you really determine microclotting? Like, unless you do, small vessel, it's very hard to determine. One, two is, I think, I have tried things like low dose aspirin, nattokinase supplement to see if that would help. I haven't seen much benefit from that. I've also done some other along the way naturopathic things. So I have done a procedure of what's called, I think, EBO2, where they take your blood out, filter it, mix with ozonated oxygen. And I have felt some relief from that, in fact, for a few days. So I didn't know if it was anecdotal. I can't say everyone should rush to do something like that, but again, in my quest for answers, I'm willing to experiment to see what works and what doesn't. But I don't know if there was the driver there of like they actually filter you and maybe drag out some things, or if it's putting extra oxygen in there that's pushing oxygen into your capillaries. And so
Got it.
don't know. Microclots is a tough one. I don't know the answer.
Got it. Perpetuum says, has Shaun spoken with Dr. Yeo and Bruce Patterson?
Yes, I have. I've done their labs. I would like to dig further with them and collaborate more. I think, they're doing such important work, right? They really have brought long haul COVID to another level, and they're also now working with the vaccine issues. So, yeah, I mean, I think there's a lot more I could learn from them and work with them on. But I have reached out to them and I have done their labs and we have talked about different treatments.
Got it. So I remember that you had talked about trying fluvoxamine at some point as well. How was that? How did your body react to that?
Right. So I did fluvoxamine, I think somewhere in March or April, if I remember. I have a timeline somewhere. I track of all the things I've tried and the different reactions. So fluvoxamine, I started low dose. I'm not keen on SSRIs for myself personally because of my own personal reactions. That should not deter anyone else from that. But I did try it and I did start low and then I increased slightly, but I found that it actually spiked my tinnitus. And so I stuck with it for about 3-4 weeks, 3.5 weeks, I think, if I remember. And then I kind of dropped it. I don't know if others had other experiences, and if they've tried higher doses, maybe that would work.
Got it. Patty Zig says, did they aspirate when you were injected with the vaccine? Could they have accidentally injected into a vein? Hope you recover very soon. So sorry this happened to you.
Yes, thank you. So that is another area of interest that in my anecdotal gathering of data, I do ask people. So in my first injection, I did have a weird injection, I have to say. When they entered me, I thought they weren't in the right spot. As a nurse, I think, nurses know how to inject best. And I didn't have a nurse for my injection. And I don't know, I felt I had a twitch of my arm on injection. I didn't make anything of that because if you just, nick the skin, you could trigger something like that in people. I've seen it before. But I did ask a lot of people if they had an unusual injection. And not everyone, but I have quite a few. It's anecdotal evidence, but they do say they've had like either a bloodier injection or they saw blood or the Band-Aid was more bloody. So who knows, right? It's possibility.
When it is possible, I'm just conjecturing here, I don't have a proof. It is possible that injection instead of the vein actually hit the nerve. And
That's
that is in
also,
the neurological traversal that
yes,
you're saying to axilla, to this area, then to the facial nerve. It is,
correct.
again, I'm totally conjecturing.
Speculate.
I
Right.
don't have a mechanism
I
to back
have that. I've had that speculation from the start. I thought, did they hit a nerve, and then somehow it hijacked my nervous system?
I think there
I
is something
don't know.
called humeral nerve over here, which is near the neck of the humerus. So if they are high up here, it is possible. Again, it's a very tiny nerve, but it is there.
Correct.
Uh, so Ashley says, "Have you low dose naltrexone?" And then I want to once
That's a
again,
good one.
yeah, I want to make sure we are not sitting here giving medical advice. You yourself are a healthcare professional. This is just, we have various things in our mind as well, that God forbid if somebody has long COVID, here are the solutions possible. So we are just
Yes,
in that spirit of having that discussion.
correct. This is my personal story, not recommendations to anyone to do or anything. Low dose naltrexone. I'm trialing that now. In fact, on the recommendation of a good rheumatologist, and I find that um, it's helpful.
And I have,
It's a good glial cell modulator, and I think that it helped my tinnitus a bit.
very good, good to know. At least there is something that is moving in the right direction. One God Jesus name says, how can people find and join your support group?
So the support groups are online. I don't really market or advertise them. I think people just sort of find them, and we only usually let people in that are have an affliction because we're very cautious. We are not an anti-vax group. We are not an anti-booster or mandate. We're not anti-anything. We're really just a cohort of people with the same affliction, trying to help each other. So I think if you just search your social medias looking for whatever affliction you might have, you'll probably stumble upon one of the groups. I think, you know.
Thank you very much. Denise TG says, many of us with these multisystemic symptoms post COVID vax end up having genetic connective tissue disorders of Ehlers-Danlos syndrome that seems to predispose us. Could this be a possibility for you? This is a connective tissue disorder of the autoimmune.
Yeah, I don't think I have any. Didn't have any signs and symptoms of EDS in my life, and I know that's genetic. And usually, you do exhibit something along the way if you had a genetic predisposition. It doesn't stay insidious, as far as I know. I'm not an EDS expert, but I did look at my genetic profiles, and I don't think I have any of those mutations that lead me in that direction. But I'm not sure. I'm not an expert on that, so I
Got
can't
it.
speak.
Got it. Thank you very much. So someone is challenging you. And Cheryl, once again, look, Shaun himself is going through this. There is no need for Shaun or for me or anyone to try to minimize something. I think Shaun is actually here telling his own story to raise
Mhm.
awareness, to make more people aware that there needs to be help in this area. I think the only care he's taking is that this is not an anti-vax rhetoric here, but to say vaccine related injuries can occur and we should look into that and help.
Right.
So Cheryl is
And
saying
I
this
can't, yeah, I think I can't speculate on the numbers. I don't know the numbers. I don't know if I don't know, how should I phrase this without getting anyone upset? I don't know if we track the numbers of effects thoroughly. Maybe we do. I don't know, but I know in my own personal case, no doctor has actually logged my symptoms. I had to log my own. And I found that a little bit disturbing. I don't know if they're just very busy or they knew I was a nurse and I would just log it myself. So that could be the case. But so I don't know, I think we're out there. We don't know the numbers, but we exist, and there are other people like me.
Got it. So Shaun, thank you very much for your time. I think these are majority of the question. Here is just one more question, and then I think we can wrap up. This is an important question. The question is from Queen City Dom. Has Shaun tried monoclonal antibodies or IVIG?
Yeah. So I'm currently trialing IVIG right now. I didn't do well with the first dose. I was, for some reason, increasing my tinnitus, which I thought was strange. So I couldn't get through the full 4-day course. The second dose, I do it every 4 weeks right now. The second course I just finished, I did it with steroids, which helped, but it made me flare for some reason, and it increased my bilirubin, which put me in the emergency department yesterday. Not great. So I don't know if I will be able to continue with that course of treatment. I'm discussing that now.
And Shaun, so sorry for what happened yesterday. We can actually see your eyes even now that there is a yellowish tint there. So thank you that you actually were in the emergency yesterday and today you are speaking with us. Thank you for being so gracious and so kind.
Yeah. No, that's just the importance of this for me was to be here to discuss this with people.
Thank you. Last question, and then I would request you to take rest, and thank you for your time. Jody says, did you check your thymus? Have you had chickenpox or chickenpox vax? Anyone offer Colchicine feel better?
That's a lot. That's multiple questions in one. That's
Yes.
very clever way to ask a question. I like that. I do that too. I haven't checked my thymus. I have had chickenpox naturally as a child. I have not tried colchicine. And I thank you for wishing me to feel better.
So, Shaun, once again, thank you very much for being here. Thank you for your time. I pray, and I'm sure that everyone who is listening, watching, viewing, they would pray as well that you recover soon and fully, and this is behind you. And as you are navigating this, hopefully we would learn something as well for what works, and maybe that would be useful for someone else as well. Thank you very much.
Thank you so much for having me. I really appreciate it. I'm very grateful.
Thank you. Thank you. We are grateful that you are here. You're giving us time. So Cool Beans, thank you very much. I'm going to hang up now, and maybe in another 5-10 minutes, we'll do a quick chit chat as well. I want to actually keep this video up instead of adding one more video on top of it. So how about we just leave the chit chat for today and meet again on Monday. And thank you very much. Have a nice weekend.